here's something we hope you'll really like.
Okay, everyone, welcome to the podcast with myself and Dr.
Matthew Plant.
All right. Today's episode is 5 things you should know before doing your plastic surgery consult. And I think this will be very helpful because Dr. Plant and I have compiled a list of the top 5 things. And we're going to kick it off with number 1. Dr. Plant, take it away.
So the first thing that I think everybody needs to know before coming in to even think about plastic surgery is that it is absolutely impossible to do any surgery without scars. If your skin gets cut, there will be a scar. Plastic surgeons are trained in making nice scars or putting scars in areas that you can't really see them. Some people heal their scars so beautifully that you can barely see them, but if you look close enough, you will always see a scar. It is there permanently and it will never go away. So everybody needs to know that. Scars do not disappear after a period of time.
I say this to my patients is that, I'm going to camouflage your scars. I'm going to hide your scars. If it's a liposuction case, they're going to be very small scars, but I or another plastic surgeon will always find your scars. And patients like to use the word invisible because they can't find them. And that's great, but I guarantee you've had surgery, a surgeon will find that scar.
Absolutely.
So number 2, I'll take this one, is kind of related to scars. So I like to tell patients is that your parents are more responsible for your scars than we are. And so what does that mean? It means your genetics, the gifts of your parents that you have. You have a mixture of your father and your mother's skin, has such a huge impact on how you're going to heal the scar that it's almost more, or in some cases more, than the surgeon putting the scar on your body.
Absolutely.
Do you use that one with your patients?
Yeah. I mean, I close every single tummy tuck the exact same way to minimize the scars. Most people have a really good scar, but some people will keloid, and that's because they're going to keloid no matter what happens, or it's going to pigment or something like that. But I didn't do anything different for your tummy tuck than I did, for the person before you that has a beautiful scar.
And the other thing I like to say, and related to this point, is that the scar that I give you is the trade-off for the result. There's no free lunch, nothing free in life. And if you want to get rid of that extra skin, if you want to lift that breast, you want to tuck that tummy, the price you pay for that result is the scar.
Absolutely. That's a really good way of putting it. I like to talk to patients about trades as well. Like plastic surgery is basically a series of trades. I don't like this flap of skin that's hanging over my stomach. I'm going to like a scar better. Get a tummy tuck.
Yeah,
I am going to hate a scar. I don't mind the flap so much. Don't get a tummy tuck.
Yeah. And that's, that's the best way to look at scars is, if the deformity or the issue is not big enough to accept the scar, then don't do the surgery. You probably look great. And there's some minor surgeries like liposuction or, a primary breast augmentation where the scar is very small, almost invisible, but we will never use the word invisible, almost invisible. And then, you can have a nice result with very little evidence. Okay. So number 3, why don't you hit him with number 3, Matt?
So number 3, I think this is a really important one. Cosmetic surgery will not suddenly change your life. A lot of people sort of get into this loop of negative thinking that, I can't find a partner in life. My career sucks. I can't get anything going. Whatever bad situation they're dealing with, cosmetic surgery is not going to suddenly change that. You're not going to go and get a breast augmentation and all of a sudden, find the love of your life for that reason or get the career you wanted for that reason. I will say that in some cases, the confidence boost that people get from a certain procedure may change the way that they behave and the world reacts to them, but it's definitely not the bigger boobs that is making a difference and making you happier overall.
Yes, I 100% agree. There's nothing wrong with getting plastic surgery to boost your confidence, to feel better about yourself, to change your body. But if it's, looked at as the only reason to change your life, then probably you're going to be set up for disappointment or sadness, and it's the wrong reason to get the surgery. I have had many patients that, went through either a divorce, a breakup, or something, and they had the surgery to feel better about themselves, and they went on to find happiness and love. But it's not the surgery. It's just exactly like Plant said. It's, the confidence the surgery is going to give you or help you along the way, but you don't, I almost said the next point. I'm not going to say it. So let's just stick to this point, is that, the right reason to have surgery is because you're trying to improve a targeted area, and that's going to make that area look cosmetically better, but it's not going to fix your life. Okay. And then number 4, or do you want to add to that one?
No. I got nothing to add. I think you covered it.
That's awesome. Okay. So number 4, I'll take this one because, I'm not shy about it. As all surgeons, I have complications. Complications happen. If a surgeon tells you that they don't have complications, they're lying. I don't know any surgeon who would say that, but it's just making this.
They may have never
spicy.
operated.
Yeah. Oh, yeah.
They've never done a case, and then they'd be telling you the truth.
That's a great saying. And the other thing, what I said to one patient who was surprised by my honesty, because I'm like, listen, all surgeons get complications. I get complications, and I deal with them. And the patient was kind of surprised by my honesty. And I said, listen, if I never had a complication or never saw a complication, I wouldn't know how to fix them, and I wouldn't be a good surgeon. Like real surgeons have problems and we fix them. And that's the surgeon you want to go to, because when you do have a problem, that's part of our job. Our job is not just delivering the excellent surgical results. It's also taking care of you if there's an issue, which they happen to everybody.
Yeah, and that's a really good point, and something that I always kind of emphasize to people when they come in and they're talking to me after they've had a couple consults, or they have a couple consults coming up, and it's with me, it's with a couple other reputable people in town. Like, they'll probably have a good result with any of those choices. I always tell them that you have to sort of look at not the best case scenario, the worst case scenario. If your surgery comes out perfect, doesn't really matter which of these surgeons you chose. But, if you have some sort of complication, make sure you choose someone that you feel like you can deal with on a very regular basis. Like, if we have a complication, I'm going to see you weekly or twice weekly.
Daily.
And if you can't stand me, then we're not going to be able to work through that. So you got to go with the surgeon that kind of gives you the most confidence that they will take care of you, and that, you'll be able to have that working relationship.
And the other thing on this same point is, I've said complications happen. And so what I mean by that is they happen to all surgeons, and all patients can potentially have a complication. So you really need to, if you're considering plastic surgery, get over that fear and realize that if you don't want any chance of complications, then probably plastic surgery is not for you, because little things can happen that are out of the control of you and out of the control of the surgeon. That's just the reality of biology and the world around us.
Yeah. And kind of like tying in with the scar stuff that we were talking about, you kind of have to go into it approaching it with, if I end up with a really bad scar in this location, am I still going to be happy? And if you are, then it's probably a good choice to go for that plastic surgery. But if not, then you got to think about what are your odds, and, what happens if it doesn't end up perfect.
So now our last point, and this is something that I always correct patients on when they say this magic word. You hit them with number 5, Dr. Plant.
All right. So this is the absolute most important thing when it comes to cosmetic surgery, not plastic surgery overall, but cosmetic surgery specifically. So what I do, what Dr. Giancarlo does, you do not need anything that we do. Don't come in and ask us, like, what do I need? Because honest guys like us, we're going to say, you don't need anything. What do you want? That's my question.
It's so common. And I actually got, I posted before and after a few weeks ago, and it was a relatively skinny patient who was getting a mommy makeover, and she didn't have that much skin. She didn't have that much fat. And she got a tummy tuck to tighten her up and a breast augmentation. She already had, decent breasts, but she wanted to go larger. And I got not a small amount of people saying she didn't need plastic surgery. And it's like, no one needs plastic surgery. This patient did it for her own reasons. She wanted to improve for her own, body goals and body image. And I was able to give that to her. So who are you to judge what she did? And who are you to judge her result and for her want? Because at the end of the day, no one needs these elective cosmetic surgery procedures. They're just wants. You want to improve your breast? Okay, I can help you. You need to improve your breast? Well, that's a whole other story, and I don't agree with you on that. Oh, there's a funny thing I like to say is when I have a patient who used the need, I usually correct them. I say, you don't need it. And if they use the word again a second time, I was like, listen, the only thing we need is food and water. Those are needs, okay? This plastic surgery is a want. And then they laugh and they kind of get it. And if we're on the same page, then you could be my patient, I can be your surgeon. But sometimes it is difficult because I'm sure you've had people that really are so stressed about meeting you or about the surgery, and they're really looking at this as a need. And it kind of touches back on some of our other points, like, I need this to fix my life. I need this to find the right man. I need this to find the right woman, vice versa. And then people who come into the consult or come into surgery with that attitude, it's not helpful for anybody.
Yeah, absolutely. It is, though, important to always remind people that there are types of plastic surgery that people absolutely do need. Those are all of our colleagues doing reconstructive surgery. If you're a burn victim, if you've had cancer and you need to be kind of put back together so that you look presentable.
Hand function, breast reconstruction after cancer, various reconstructions after injuries. Those are needs. I would 100% support that. Even breast reductions in some cases, people have back, neck pain, a breast reduction. It can turn from a want to a need. Like, I need this. My quality of life has gone down because my neck and my back hurts. I can't exercise, No disagreements there.
Yeah, they need the reduction. The lift part is a bonus want.
Yeah. Well, yeah, you can totally get into gray areas, but I think if you're listening to us, you're getting at the message that we're trying to get across. Lip injections, facelift. These are all wants. You don't need them. And so that is our list of 5 things that you should know that we as plastic surgeons want you to know before your consult, so you're better informed. You can be a better patient, and we can be a better doctor for you.
Well said. I don't think there's anything more to add to that. So it's a little bit of a shorter episode, but I think this is where we should cut it off.
Yes.
Absolutely perfect episode.
Right. See you next episode.
Now here's something we hope you'll really like.